folks. Welcome to your overview on e-charting at the West Coast College of Massage Therapy. Long gone are the days of chiseling your treatment notes onto a stone tablet. After a little practice, you'll wonder how we ever paper charted in the first place. In this video, we will be breaking down the steps to chart your interview and assessments. We will first review Term 2-3 charting, followed by Term 4-5. In additional videos, we will take a look at charting your reassessments, treatment notes, and home care. Your staff intern account will be created for you and will be reviewed during your clinic orientation. So let's get started. In order to access the charting for your client, you will first go to your schedule and click on their appointment. A sidebar will now open on the right under Booking Info. Move your mouse to hover over the right of the booking panel until the View tab appears. Click on View. Under your client's name, you will now see a row of options including Chart. Select Chart, and to the right of Chart Entries, click the down arrow for New Chart Entry. Scroll down until you find a Term 2 and 3 interview, and click on it to open the chart. Begin your interview with the wellness screening. As the intern, you will check the box that confirms your client is free of cold and flu symptoms. If your client is unwell, check this box, discontinue treatment, and lock your chart with a clinic instructor. If your client is well, check this box and continue. Next, you will find prompts for the interview portion of the appointment. These prompts are all adapted from the physical forms you are all familiar with to this point from either clinic or clinical assessment. Click inside the comment box and add your interview notes beneath each bolded prompt. As this is a guide to support the flow of your interview, you may also elect to write your notes above the prompts. Once you have discussed and documented your client's goals and areas to be treated, you will obtain consent. Once consent has been verbally established, you, as the intern, will check the box below to confirm you have received consent. Close the interview chart, not lock, and move on to your assessments chart. Scroll back up to the top of the chart entries. Click on New Chart Entry and select B, Term 2 and 3 Assessments. At the top of this chart, you will find a body diagram where you may document posture, pain patterns, and areas of tension or complaint. Using the knowledge you have obtained in clinical assessment, proceed to record your observations and client comments with the tools on the left-hand side. Let's first select the pencil tool, as this is the style of charting you will be most familiar with from Term 1. Once you have selected the pencil tool and using principles from clinical assessment, select black, red, or green to note postural observations, areas of pain, and/or nerve involvement. Colors may vary depending on the device being used. Next, place your mouse over the area you would like to draw. Most devices will require you to left-click, hold, and drag across. If you make an error or need to redraw the area, simply click on the back arrow found here. If you would like to keep what you had previously, simply click on the forward arrow. To move between colors, select the box of the color you would like to use and continue. If you need to remove a portion of your drawing, but not all of it, select the eraser tool found here and make your edits as needed. At the top of the Tools column, you will see the pointer, which can be used to number your notations. Click the area focused and a comment box will appear with the corresponding number for you to make notes as needed. You may click on as many areas as required. Next, scrolling down is our Joint Range of Motion assessment area. The first box is where you will type in the joint being assessed, separated by left and right with the ranges below. Type in the joint being assessed and scroll down to the star diagram. Selecting the pencil tool as we did a moment ago, make your markings on the star diagram under Pre-Treatment. The degrees can now be added to the box above, or if you can ensure it is legible to do so, you may write the degrees on the star diagram itself. Otherwise, in the box above, record the degrees beside the ranges listed above. The degree symbol can be found here at the bottom on the far right side. Below the pre-treatment star diagram, please note the post-treatment star diagram. You will be returning to this box and others, which we will see below, for your reassessments and post-treatment. There is a second identical assessment area that can be used to assess an additional joint. Next is an area to record your resisted range of motion. As above, type in the joint or joints being resisted, the range being assessed, and the result beside left and/or right. Next is our functional movements. Again, as above, type in the ADL or functional movement you are assessing and record the results under the pre section. An additional functional movement, or ADL, is found in the same box below. Next is our manual muscle testing. This follows the same procedure as the resisted range of motion and ADL boxes above. Type in the muscle being assessed, followed by grade and pain result under the pre section. Below these assessments, we find an area to make comments and observations for pre- and post-treatment. You may now close, not lock, your assessment chart. Head back up to New Chart Entry, select the drop-down, See Term 2 and 3 Treatment Report. This is your third and final chart for today's visit. At the top of this chart, please select whether your client is new to you or returning by checking the appropriate box. Here you will fill out the following comment boxes to record treatment type, contraindications, and precautions. The next field is where we will record goals for treatment. Again, clicking in the comment box, document your goals, and once complete, scroll to the bottom and close, not lock, the entry. The content you have scrolled past will be filled out post-treatment. Now it is time to sign off with your clinic instructor. The clinic instructor will review your interview, assessment, and treatment charts with you. As you review charts with your clinic instructor, click on the entry you would like to review, which are logged in chronological order. Once the interview has been reviewed, the clinic instructor will sign their name as a signature or type their name in. Please note, the signature must be done by the clinic instructor and not typed in or signed by the intern. Once the interview has been signed, the intern will lock the chart with the clinic instructor present and move on to review assessments. Review your assessments with a clinic instructor who will again sign their name as a signature or type their name in the pre-treatment area at the bottom of the assessment page. Once the pre-treatment assessment has been signed, the intern will close, not lock, the chart with the clinic instructor. This will be done after reassessment. Lastly, review your goals for treatment, contraindications, precautions with your clinic instructor. Once reviewed, the clinic instructor will sign their name as a signature or type their name in. The intern will again close the chart with the clinic instructor present, not lock. Again, this will be done after you have completed your treatment notes. And now, like the rock star intern you are, you'll prepare to head back to your client for the treatment portion of the appointment. The interview, assessment, and treatment charts we've just gone over are for Term 2 and 3. Let's take a look at the charting for Term 4 and 5. We will head back up to the top of the chart entries, click on New Chart Entry, and select A, Term 4 and 5 Interview. You will see that aside from less prompting in terms of interview questions, that the interview chart is identical to Term 2 and 3. At the top, we have the wellness screening, our interview section, followed by client goals, areas to be treated, client consent, and a sign-off area for the clinic instructor. Head back up to the top of chart entries, click on New Chart Entry, and select B, Term 4 and 5 Assessments. The first box you see is the same one we went over for Term 2 and 3 for postural, pain patterns, and areas of complaint. Below the body diagram is an area to record vitals pre- and post-treatment. Record your results in the appropriate boxes below for pulse, respiratory rate, and/or blood pressure. As with Term 2 charting, you'll return to this area post-treatment for your reassessments. Next are the sections to record your assessments for joint range of motion, resisted range of motion, manual muscle tests, and activities of daily living. Again, these are identical to Term 2 and 3 charting, with the exception of APLES, which is prompted at the top of the ADL functional movement section. The sections we see below are specific to Term 4 and 5. First is capsular pattern. In the comment box to the right, type in the joint being assessed and document your findings. Next is pathological end feel. Again, type in the joint being assessed and document your findings in the comment box. Below this is where we find an area to record results of our muscle length assessment. As in the boxes above, type beside or below the prompts under the Pre heading. Our next section is an area for commonly used special tests. Select our good friend the pencil tool and circle the appropriate result to notate your findings. Following special tests is an area to record your myotomes and dermatomes. As above, select your trusty pencil and circle or trace where appropriate. An area for comments, observations, and palpation findings is our last section. You may also use this area for additional special tests not noted above. A couple of notes. You will have probably noticed that when you click in some of the boxes that a menu of symbols pops up. A legend will be included in your treatment areas that will assist you in using these symbols to up your shorthand game when you are ready. Please remember that at no time is an intern permitted to sign a clinic instructor's name on their behalf. This is considered fraudulent, which will result in an immediate breach of code of conduct and consequences, and nobody wants that. For some of you, interns and clinic instructors alike, this may seem either overwhelming or straightforward based on your familiarity with Jane charting. It will take some of us longer to get comfortable and savvy as we all learn at a different pace. Please adopt an attitude of patience, kindness, and respect with one another as we all navigate the learning curve and new protocols of electronic charting. In the next video, we will review treatment notes, reassessment, and home care. See you there.